Hello, everyone. My name is Azarreia Paulos. I'm currently a senior studying in Addis Ababa, Ethiopia. And today I'm going to speak about my research, which is about postpartum cardiomyopathy in Ethiopia. So I'll firstly begin with the introduction, which is a summarization of like the biological background and how everything works. And then I'll move on into the methodology, which is the research design, the ethics approval, data collection procedure, the research question, and everything in relation to the research setup. And then transition into what I found from my data, so the results and the discussion. And lastly, I'll make some conclusion and evaluation and some final remarks about the study and how general some acknowledgements. So to begin with, postpartum cardiomyopathy or PPCM is a type of heart failure that occurs in the latter stages of pregnancy or 6 months postpartum. That's why it's hence referred to as postpartum. And like I said, it's a type of heart failure where the cardiac output is hindered due to left ventricular dysfunction. So the left ventricle, which is part of the heart, doesn't really work properly, and as a result, it hinders the amount of heart that is pumped out to the rest of the body. And because it's a type of heart failure, it shares a lot of symptomatic similarity with other types of heart failure. The risk factors, at least from what has been studied so far, is things like high parity. So the number of pregnancies a mother has had prior to this one, that presents itself as a risk factor. Pregnancy-induced diabetes and also pregnancy-induced hypertension, things we refer to as gestational diabetes and preeclampsia, and also advanced age. Age plays an important role in this in the incidence of PPCM. So there's some abnormal immune responses that occur within the body. This is because a mother's body during pregnancy goes through hemodynamic changes. So there's changes with cardiac output, with blood pressure levels and all of this stuff. And what this results is there's abnormal immune responses that occurs. And I've decided to study two specific types of, two pairs that are both bidirectional, meaning they go hand in hand. So oxidative stress and inflammation is the first specific type of abnormal immune response that I've studied. And the second type of abnormal immune response is procreating cleavage and microvascular dysfunction. These are the two pairs of abnormal immune responses that I'll be looking at specifically and that I looked at during the study in reference to the incidence of PPCM and how they correlate. So moving on to the methodology, this is where information about the study in general. So with the study design, what I conducted was a cross-sectional hospital-based study. So what this meant was within a hospital setting, which specifically was St. Paul Medical Millennium College. And this is a hospital based out here in Addis, where I live. In this hospital setting, I conducted research over a 2-year period. So we were looking at patient data within a 2-year span from January 2021 to 2023. And during the span, we were looking at the incidence of PPCM amongst mothers that came from all over Ethiopia. And then some of the biomarkers that I looked at or in reference to the two pairs of types of abnormal immune response was, for example, for oxidative stress and inflammation, I looked at blood pressure ranges and patient data amongst those ranges and how they were distributed and the patterns. And also gestational diabetes, or what we know as pregnancy-induced diabetes. And for procreating cleavage and microvascular dysfunction, what I looked at was high parity, so the number of pregnancies a mother has had prior to this specific one, and also a body mass index, so body mass index ranges and how the patterns of data in reference to the incidence of PPCM. So for the study population, we specifically within St. Paul Hospital, we looked at patients in 3 different hospital units. So the high risk pregnancy unit, so that's what we refer to as HRU. We looked at the high risk antenatal unit, which we refer to as AU, and finally the maternal and child feeder care unit. So that's the MCFU. prior to me going into the exclusion criteria, the inclusion criteria for this study, or basically how we included patients, is mothers that were between the age of 20 and 40, so older than 40, older than 20 and younger than 40 were included in the study, but those that were not in this range were excluded from the study. And also patients that were between 20 and 40 years old, pregnant mothers between 20 and 40 years old, were also excluded, that were morbidly ill, were excluded from the study. And the total sample size for the study was 250 patients. With every type of research, ethics and ethical approval is a very big important part, and that's something I made sure that I emphasized on my specific research. So for ethics approval, firstly, we got institutional review board approval. So basically, with the help of Polygence and also my school here in Addis, we got documentation cleared by the hospital to conduct research. Patient consent, patient anonymity, and patient ethics around patients is an important part. So for this study, I made sure that patient consent was received and patient anonymity was maintained. So all patients were aware of the study prior to it being conducted. And for the data collection process, we conducted prospective and also retrospective data. For prospective data, we created a questionnaire list and conducted interviews with all the patients that were included in the study. But we also looked at patient data from hospital charts that were there present. So we did a balance of prospective and retrospective data. And at the end, I kind of got to this research question of to what extent do abnormal immune responses among pregnant women in Ethiopia affect the development of postpartum cardiomyopathy? There was a specific reason why I got to this research question. One being there hasn't been a lot of research done on postpartum cardiomyopathy. And for countries like Ethiopia that are considered to be low to middle income countries, the incidence continues to rise due to many factors like socioeconomic factors that inhibit mothers from accessing equitable healthcare. And also this basically means that there's late diagnosis and other factors that hinder a mother's ability to access quality healthcare. And there hasn't been a lot of research done on this because hospital data here isn't the best. And luckily enough, we looked at a referral hospital, so there was a lot of data that I was able to work with. So investigating this research question, what I did is for the research, we broke it down, like I said, into two pairs of abnormal immune responses. And then we looked at the biomarkers for the specific abnormal immune responses that I mentioned and how that led to the pathogenesis of PPCM. So for blood pressure ranges amongst the data that was received, so we said that there was 250 patients, but unfortunately we could only access about the blood pressure ranges of about 204 patients. And we found that there was 132 out of the 204 patients that were diagnosed with preeclampsia or pregnancy-induced hypertension. And we also found that for gestational diabetes, there was about 40% of the patients with gestational diabetes. So this made us this made me realize that there was a very big correlation or a strong correlation between gestational diabetes and high blood pressure and the incidence of PPCM. Because out of the number of patients that were diagnosed with this, we found again 40% and also 132 out of the 204 patients. With protein cleavage and microvascular dysfunction, with the body mass index, we found that there was about 18 to 33% of the patients that were diagnosed with PPCM that were classified as overweight or obesity class 1, and 45% of mothers had 4+ pregnancies. So these two risk factors were a big factor in the incidence of PPCM. And finally, moving on to the conclusion, we know that, like I said, PPCM is on the rise in Ethiopia and the rest of the world. The main factors continue to be things like diabetes, hyperity, advanced age, and obesity, and that's why it's necessary preeclampsia. Something that's necessary is avoiding sedentary lifestyle, but also dietary changes. This will lead to reduced risk of getting the risk factors that will result in the incidence of PPCM. But it's important to conduct more studies because, like I said, there have been few studies that have been conducted on this on this topic. And lastly, for the evaluation, some of the strengths of the research was like it was both prospective and retrospective study, and also a referral hospital. So both of these led to a holistic representation of the data in Ethiopia on the incidence of PPCM. And from my knowledge, this was the first paper that was evaluating PPCM in Ethiopia. However, a limitation is that because it was a cross-sectional study, there was a time limit and a boundary that, in a sense, could have impacted how the representation of the data as a whole. And finally, I would like to acknowledge some people. So my research mentor, a senior resident at St. Paul Hospital that helped with the data, and also general hospital staff within the following hospital units that helped with me conducting and gathering data. And lastly, the high school staff that I go to that helped with the IRB approval. Thank you so much for listening. If you would like to read the paper and also look at my LinkedIn profile for further details, you're free to use the QR codes that are provided. Thank you so much, and I hope you enjoyed the presentation.